Good afternoon, everyone. Welcome to our COVID-19 webinar. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Today, we're testing a new webinar format, recognizing the need to implement social distancing policies to assist with containment during the pandemic. We've gone to a platform that will allow participants to all join the webinar remotely, including our speakers. So bear with us as we go through this format. It should be pretty straightforward. And as always, this webinar will be recorded and posted on the hub for people to listen to after it occurs. So we'll share that link out. You can circulate it to your colleagues, and as well, it'll be part of the daily dispatch on COVID-19, as well as part of the hub app content moving forward. So I'm joined today by several speakers, our President and CEO, Rob McIsaac, Chief Operating Officer, Dr. Wes Stephen, Chief Medical Executive, Dr. Michael Stacey, Chief Nursing Executive, Kirsten Kroll, EVP Dave McKeag, VP of Human Resources, Michelle LaRue, and as well our VP of Capital, Kelly Campbell. So I'm going to moderate this discussion and call on our speakers individually to answer some questions. The questions that I'm asking today are really based on the questions we've been receiving at the COVID-19 staff email line. So there is an email line that staff can use to send questions that they have about the ongoing response at Hamilton Health Sciences to the COVID-19 pandemic. And those questions are forming the basis of our discussion today. Our goal is to have another webinar every 2 days, so we'll have another one planned for Friday, and we'll continue to address content that's coming up through that email line. So I guess I'll start right away. My first question goes to our President and CEO, Rob McIsaac. Rob, the provincial response to the pandemic is changing daily. There's new directives coming down. I know you're part of the ongoing effort to organize at a regional and sub-regional level. Can you talk a little bit about how are decisions moving from the top down? How are we plugged in as an organization, and what can we expect to see next?
Yeah, sure. I'm happy to talk about that. So I'll try to go over this briefly. There is I'm going to say a comprehensive command structure that's been set up for the province of Ontario. Starts obviously with a provincial table where the deputy minister, the chief medical officer of health, and others are both monitoring what's happening across the province and issuing direction and policy in response to this evolving situation. There are 5 regional tables that are reporting in and receiving information from that Central Ontario table. We are part of the Western Ontario region, and so I am sitting at that table, which gives me a kind of a portal through to the Central Provincial table. And I can both escalate issues to that table and also take directions from that table and bring them back to our region. I'm chairing the local regional hospitals, so that the hospitals that make up what used to be the HNHB LHIN have continued to constitute a kind of sub-region. So that is a group that's meeting twice weekly. We are comparing notes across a variety of issues and trying to get at whether or not there is capacity that can be created by us sort of thinking and acting like a system at this sub-regional level. So that work is ongoing. And of course, there's a command structure that's been set up within HHS, which meets daily, comprised of most of the vice presidents within the organization. Certainly the clinical VPs are all at that table, as well as the executive group and others. And we meet every day at noon to talk about issues that are coming up and to try to set direction for the enterprise. We're also trying to coordinate as much as we can with St. Joe's and with the City of Hamilton at that scale. So there's another table that's set up, which is a city table, which meets quite frequently too. The issues that are dealt with across all those tables are the same issues that people are probably thinking about on a day-to-day basis. Things like workers returning from international travel. What's our capacity to deal with differing scenarios in terms of how extensive the infection rate in the community might be and what that means for demand on us. Issues around lab and testing and whether or not we have the capacity to handle the incoming tests that are likely to be generated across Western Ontario, setting up assessment centers, screening, and so on. Many of these issues we'll talk about in the context of today's webinar, but they are dealt with both up and down the line through that structure that I just talked about.
So it's fair to say the decisions we're making as an organization are integrated into this process in a big way.
Well, as much as possible. I think we all have to concede the fact that this is a very dynamic, rapidly evolving situation. So I think we have to sort of beg people's patience when they see things changing on a daily basis. It's not so much because we don't have a solid structure set up for making decisions. It's more about us trying to respond to a rapidly changing situation.
And one of those rapidly changing situations has certainly been the directives being provided to people returning from travel. And certainly given the timing of all this around March break, a good number of the people that work at Hamilton Health Sciences, our staff and physicians included, have traveled or have recently traveled. And I know are asking questions on the email line about when and how to self-isolate or when to come to work. This is an evolving policy area. I guess, Dr. West Stephen, I want to ask you first, and then Dr. Michael Stacey, as it relates to the physician population, like how should people be thinking about this issue? What's our current approach, and how is it changing and evolving?
Aaron, great question. I think we'd all recognize that providing healthcare in our community is an essential service, and we need to maintain our ability to provide that care. This has been a very dynamic file where there's been a lot of conversations, and I would just like to highlight some of the principles and then go through the decisions where we've landed as of today. There is the issue of us providing public safety. And there's also the issue of safety of our staff and our physicians and containment of the virus. We also have an obligation to be prudent stewards of a limited resource, which is PPEs and particularly around masks. And we'd also have a desire to have consensus with our partners of St. Joseph's and the University of McMaster, so that there's no confusion that we all have the same approach to international travel. I would say that we are strengthening our approach at HHS to self-isolation, which is aligning with the federal government and also with the provincial directives that's coming from Ontario. So essentially, we are taking a strong position that we wish for all our staff when returning from international travel to stay home for the 14 days. We recognize that there will be extraordinary or urgent situations where we will need to bring staff back because we're not able to replace them or because of the nature of the work that they do, we're in critical shortage. In that scenario, our current position will be that the staff will mask during this period of time. Once again, I'd like to emphasize that we would anticipate this would be an extraordinary situation where we would have staff that we operationally cannot replace either with redeployment of other staff or changing people's schedules to allow for us to provide that staffing. We recognize that this is a very changing situation, and obviously these decisions will need to be reviewed in a timely way. From a mechanical point of view, if patients are if staff are symptomatic, you stay home and you contact public health and you contact the employee health. If you're asymptomatic, you will have a conversation with your supervisor or manager to see whether you can be replaced from an operational point of view. If so, you stay home and you do your 14 days of self-isolation. If there's an extraordinary circumstance where we need you to work, this will occur after an escalation to EVPs or VPs for approval that it's a critical service, and that there is no staffing alternative. So that is our current position, which is supported by St. Joseph's as well as the McMaster University. So I'll stop there and maybe turn over to Michael, and he can talk more about the physician side.
Thanks, Wes. I mean, really just to echo the comments that Wes has made, and I think essentially symptomatic patients, it's very simple. They stay home and self-isolate. For asymptomatic staff, our default position is that they also stay home for the 14 days and self-isolate. And as Wes has said, if we do have a critical need for either their expertise, which is lacking in the organisation with other people, or if we've got a desperate staff shortage, then we may call some of those people back to come in. And if they were to come in, assuming they're still asymptomatic, then the requirement will be for them to wear a mask for that period. We see these as being somewhat exceptional situations, and the decision would be taken with, on the medical side, their chief, and chief would obviously let me know about that as well. On the staff side with the director, and that would be escalated to the VP as well. So the point of all of this, I think, is that we're trying to ensure that we have a workforce that is able to be at work and to provide the service that's needed for the patients that come into our door. And we don't threaten that workforce by exposure, and therefore a need for some of that workforce to themselves go and self-isolate. So it's really trying to maintain a workforce that is able to deliver the care to the patients who come into our organisation. I'll turn back to you, Aaron.
Yeah, thanks a lot, Michael. I wonder if I get Kirsten Kroll, our Chief Nursing Executive, I wonder if you could talk a bit about, like, what are we telling our staff, what would we tell our nursing staff if they're feeling unwell right now? What steps should they be taking? What should they be thinking about?
Well, I mean, it does depend if they've had a travel associated event with not feeling well. But certainly if you're not well, you should stay home regardless. You never know what's going on. It could be other influenza things that are happening. So err on the side of caution. If you're not well, stay home. And certainly if you've had a travel history and or contact, again, like the criteria that we have around the organization, contact with somebody who has recently traveled or has had some confirmed obvious COVID issues, that you should be connecting with public health, and more likely would be advised to look at registering potentially for an assessment through one of the clinics, but would follow the direction of public health really at that point in time. And of course, letting health, safety, and wellness know that you're not well as well, and they can also provide some advice to you.
Thanks, that's great. I guess I'd point out too to everyone listening that, you know, if you have questions about this, you can also review any of the policies that are on the hub, ask your leader certainly, or also email the staff COVID line if you want to just get an answer. We're trying to keep up with the pace of questions and answer in about 12 to 24 hours in most cases. We've been able to do that so far. Another hot topic coming up through that line is the issue of supplies. I guess the situation at our front lines is that we are going to require some critical supplies and as well, I guess, across the entire organization. I wonder, Dave McKeag, if you could talk a bit about that effort, the conservation effort that's underway. Like, how are we going to assure that we have what we need moving forward?
Thanks, Aaron. So some of the similar messaging from the brief webinar, we're still in a situation where PPE is global constrained. What that means is that HHS, just like every other organization, is on what's called a global allocation. So we receive a certain amount of PPE, but there is no extra to be ordered or to be found within the supply chain. We work with our regional partners and suppliers, directly with vendors. We're looking to source any alternatives possible. But again, it is going to be a constrained environment. What that means is conservation principles that will be rolled out shortly will be critical to ensure that we're using PPE only when and if and where we should be, and maintaining those stocks as best we can for our staff going forward. On that note, I do have to point out that there have been anecdotal incidences of hoarding or even removing PPE for personal use off-site, and those are not acceptable activities and would result in disciplinary action. So again, it's a matter of ensuring that we have what we need for our staff and physicians and patients. And again, I just have to reemphasize conservation strategies will be critical.
Absolutely. And this is really, I mean, this is a provincial-wide issue, isn't it?
It's a global issue, Aaron. It's not just HHS, it's not just Hamilton, it's not just Ontario, it's everywhere across the globe. These supplies are in scarce supply and high demand. So global allocation is exactly what it sounds like. Companies like 3M are in a situation where they are allocating stock based on previous usage, and whatever they have available, they make available to all of us.
And I guess another area where we're seeing the global demand for service outpace the needs at a local level. I mean, I'm told internet broadband is strained. We also today have reports of our own telephone lines, people getting a busy signal calling through. Can you talk a bit about the strain that's on some of our essential systems? I guess it's kind of a similar driver. Even to get this webinar up and going, we were limited to 3,000 participants, which sounds like a lot. But the companies are having a hard time keeping up with the demand in Ontario, across Canada, as we go through this pandemic.
Very true, Aaron. It's very much a nationwide, probably global as well, but very clear that it's a nationwide demand for bandwidth. We've been working with Bell for several days, actually, a couple of weeks ago, in terms of expanding both our main telephone line capacity and also our internet bandwidth. These things are in process, but Bell is simply overwhelmed with demand right now. So we do expect to, so our internet usage right now is not overwhelming our network, which is great, but it's growing. And what we intend to do and should have in place, hopefully within 24 hours, although we've been given the message of 24 hours more than once, is doubling our internet capacity. Once that is in place, we also intend to roll out free Wi-Fi across all of our sites to offer better connectivity for our staff, patients, and visitors. But all of these things will have to come with that internet bandwidth expansion, which we're hoping will be shortly. Also, our main telephone line is getting overwhelmed due to a lot of calls from the community. We tend to use that phone line for conference calls internally, and we'll be sending out communication, email communication later today for opportunities or ways and methods to try to ease the demand on those lines.
Thanks for that, Dave. Going to another topic, certainly we've seen a lot of questions, HR-related questions. Michelle Leroux, I'm wondering if I could get you to comment on a few things. One of them was around Kronos, and as we're trying to limit the spread of COVID-19, how should people be thinking about that in terms of the sign-in, sign-on system that we have for fingerprinting?
Hi, Aaron. Thanks for that. Sorry, a little technical delay on our end. So I'll repeat what I just said. Just a reminder to everybody that there's extra cleaning efforts across the hospital, particularly in our high traffic areas. Hand hygiene is something we all is near and dear to our hearts to prevent the spread of infection. We all do it. Just a reminder to our personnel to regularly wash and disinfect your hands through the course of your workday. As far as the Kronos terminals, we have done a review to look at the potential of temporarily removing the swiping when you put your finger on the terminals, and we should have an update on that shortly. So stay tuned, watch the hub for more communication on that. But in the interim, just our hand hygiene policy is important to remember.
And another topic for people that I know that's come up, and we've answered this question a few times, and maybe I get you to comment on it here, is about travel between sites. So we're trying to limit non-essential travel between sites. It's a big part of the lived reality for some of our staff. How should people be thinking about that and making decisions about when it's required or when it's not appropriate in this context?
Of course. Yeah, we still continue with the same message that we shared about a week ago. We continue to encourage you to limit travel between sites only when it's required for patient care or necessary hospital business. That said, you know, where you have questions about is it appropriate and sometimes it is necessary, talk to your leaders. For staff as they work through different reassignments, you know, we'll act in accordance with our policies. And again, our leaders will help support you through that in HR.
And then thinking about our workforce, certainly I think containment is a top priority that does unlock some capacity in some roles. Thinking about some roles that might now be able to be redeployed for other jobs in the organization. Can you talk a little bit about that? How is that moving forward and what can people expect?
Of course, thanks, Aaron. At this point, our priority is the visitor screening stations to ensure essential care is maintained. We've developed some guiding principles. We've got a great group that's looking at our different reassignments. We've got our chief of nursing practice, HR, a number of different people on this committee that have designed these guiding principles. So right now, leaders are working with HR and this committee to figure out how to make sure we have enough resources for the visitor screening stations, and more will follow around this process as we move forward with different priorities.
So speaking of screening, I mean, that's a big move that's happening tomorrow morning. I know we've already started at the Cancer Center, but across the other sites of Hamilton Health Sciences, as of tomorrow morning at 6 a.m., we'll be screening all visitors. I wonder if I could get some commentary on that. I'd turn to you, Kelly Campbell. Could you tell us a bit about what people can expect tomorrow, staff or visitors?
Yeah, thanks very much, Aaron. As you mentioned, this morning we started screening at the Dravinsky Cancer Center. We also started restricting entrances, streaming staff and visitors separately, and we will continue our visitor screening, expanding to all sites beginning tomorrow morning at 6 a.m. There's a list of screening times, entrances for staff and visitors available on the hub, so staff can certainly access that. We're asking right now our staff and our physicians to self-screen using the ministry guidelines that are posted and available. And then a reminder to all staff, they will need their HHS ID badge. So if you don't have one, today's a good day to go to your site security office to get one, or at least to obtain one before your next shift.
Okay, thank you very much. So that's certainly a big change and one that's very important for the containment effort. Thinking about, you know, Michelle mentioned earlier hand hygiene and hygiene just generally. What's going on in terms of keeping our sites clean? Are we seeing an enhanced level of cleaning right now to manage during this pandemic?
Yeah, we definitely are, Aaron. Our customer support services team and our Crothall core housekeeping staff continue to work diligently to keep our facilities clean with that critical goal to decrease the spread of organisms and ensure the safety of our patients, our staff, and our visitors. We have begun enhanced cleaning in all of our high touch and high traffic public areas, including things like washrooms, nursing stations, any waiting areas, lobbies, and entrances. In addition to this, there is supplemental patrolling by housekeeping each day to remove waste, wipe down high-touch surfaces, and replenish supplies.
And then thinking, I know it came to my attention today, a public health measure that was enacted in our dining areas. Kirsten, I know you've been doing a lot of work with public health. Can you talk a bit about why they might have shut down our communal dining areas And then maybe Kelly, what happens next in terms of where people will eat?
Yeah, thanks. So of course, this is in line with the order from the province to close many public places, including restaurants and so on. So same sort of action in our public space where food is being provided and common space for sitting and so on. Have reached out to public health only because, again, I think our organization is quite different now that we're turning off visitors, particularly. So much less traffic, but we also are interested in having staff be able to find space between each other. So being in a crammed lounge for a meal and so on is not ideal. So we are trying to see if we can get some of that space reopened so that we have some movement or space capabilities between our employees and our physicians as well. So stay tuned, and I'll turn over to Kelly for the final other comments.
Yeah, so today we'll be communicating out our Hamilton Health Sciences Volunteer Association that runs all of our retail operations. We'll be communicating some closures beginning tomorrow for all of our site gift shops, as well as some of the retail food outlets. There will maintain at least one retail food outlet at each site. And as Kirsten mentioned, we're working through now with public health around seating and the appropriate social distancing in those areas that remain open. We're hopeful that we can continue to offer those locations for our staff.
All right, thanks for that. It seems there's so much changing. It is difficult to keep up. We are at 30 minutes. I want to be mindful of time for today's webinar. There's certainly more questions we could answer, and we're going to keep trying to do that. We're going to host one of these webinars every 48 hours as long as people are still sending in questions and still signing up and attending. We think it's really important that we do that. I just want to, I guess, in closing, remind everyone that this is going to be this has been recorded and will be shared. So you can, if you found it useful, if you're tuned in, you found it useful, please tell your colleagues where they can get this. It'll be part of the daily dispatch and posted on the hub. You can always go to the hub for more information about the COVID-19 response that's evolving every day. We're trying really hard to get information out to people as quickly as we can. You can get the hub app as another way to get breaking information outside of email, not having to log on to Citrix, etc., and just get it pushed right to your phone. I know a lot of people have signed up for that app. You can just go get it in the Apple Store or the any app store and get that on your phone. That's critical. Our next webinar will be Friday at 2 p.m. So in that, between now and then, if there's questions that are top of mind for you, send them through to the email line that's accessible on the hub so we can think about what we're going to talk about on the next webinar. So thanks everyone for making time for this and for all your efforts. Stay safe, and we'll talk again soon.